Thank you, Zane. Again, I'm Russell Bowles. I'm the manager for the desk review remediation process. And so with the child placing agencies, a couple of things is everything is all handled through the remediation tab for child placing agencies and on the Community Connections KS.org website. So you should be able to go there initially before you even log in. You can go to the website and then go to remediation resources. And then that will take you, if you click on that, it'll take you down to evidence guidance. And then as you scroll down, you'll notice on the right-hand side, there is a, I call it goldenrod, some people call it brown, little bar that you click on, and it will open up for evidence guidance to kind of tell you what each question, evidence each question is asking for. So that's one of our resources that's available for child placing agencies. So with that, we've already passed our July deadline for that, so that's not that concerning for the heightened scrutiny, since you only have one question, that is that, and it can also be resolved through the remediation process. So I think with that, I'm sure there'll be questions, so I'll just kind of open myself up to questions. We're ready for that.
All right, Russell. And really quickly, I saw in chat that Leslie said it would be helpful if folks could add what agency they're with to their name. If you hover your mouse over your square on the screen, you'll see 3 dots. You should see 3 dots, and there should be the option there for you to rename yourself. However, if you don't see that, if you want to put what agency you're with, I can add your name and agency to your box while we're taking questions. So very quickly, I want to give instructions for how to participate. There's a few different ways that you can ask questions. We do ask that you use the raise hand feature if you're familiar with that. It's down on the bottom action bar, and it's part of your reactions. That'll let us know that you're ready for a question, and I'll call on you. You can also put questions in the chat box. And if you saw Leslie's chat pop up, you should see where the chat box is and be able to type in that. And I'm not sure if anybody called in on phone. It didn't look like they did, but if you called in on the phone and you need to unmute, you might need to press *6 the first time to be able to talk to us. All right, and with that, we're ready for our first question. We're a small group, so if you're not finding the raise hand feature and you want to ask a question, go ahead and unmute.
Hey, this is Ellen with Eckerd. Just real quickly, I have on our remediation, I'd submitted policies and the policies were approved, and then I needed to submit some additional evidence, which I did probably 2 weeks ago. And I guess my question is how long does it typically take, because the evidence is under review, before we'll get an answer on if it's approved or not?
Yes, it's a good question. I wish I had a specific time period to give you, but a lot of it bases on, and especially, unfortunately, since July 1st hit, we have had a huge influx of evidence that has come in. So we actually started not too long ago a provider support specialist program, and so they'll review that evidence and forward it on for specific providers. So we should have someone that's specific to that. We are really trying to stay to where we're able to get everything validated and reviewed in less than a month. I know that kind of sounds like a long period of time, but we just jumped over, what was it? Almost 10,000 pieces of evidence in the last week to review. So we'll be getting through that as quickly as we can.
Okay, thank you.
So, but by all means, absolutely keep checking in with us. So with that,
Hey, just a real quick follow-up question too is on the evidence that I'd submitted. I'm working on revising some forms, and I tried to go in and update one of the forms that I had submitted and replace it, but it wouldn't allow me to do so. Do you know how I could do that?
is it one of them that's still in review, or is it?
Yeah, it's in review. I submitted it, it's in review, and I need to update it, so.
Okay. Percy, if you could take Ellen's name down and make sure that we get our PSS person to contact her. Because then what we'll do is we'll take whatever, if you want to just replace the evidence that you've got there. Part of our new process is hopefully, now this is not what we want everybody to do, but because your evidence may actually be pretty good. But our intent is the PSS person can kind of look at your new evidence you want to submit, the old evidence, and then they can just kind of validate that, push it on through. And so that we get it through the system so you can upload new evidence.
Okay.
So we're hoping that helps streamline some things so it's not taking as lengthy a time to get back so providers can keep moving forward.
Okay, that sounds great. I appreciate that. Thank you.
All right, thanks for those questions, Ellen. We are ready for the next question. Does anyone have any questions about remediation or heightened scrutiny for CPAs?
This is Amy Harmon from Calm.
Hi, Amy.
Hi. I am excited to report that out of the 6 questions that I'm working on, 2 of them are compliant. So I have a few questions on the remaining 4. One of them is regarding the policies or procedures for the privacy to persons served using telephone, internet, and other personal communication devices. That would be F3. And I submitted evidence for privacy regulations out of DCF, which I think I know where I need to correct. They want more specific policy numbers. And then the other one, though, was prudent parenting. When it gave a review, it stated that it specifically needed to relate to the privacy for that. Do you have any guidance on what additional information we need to provide outside of the prudent parenting model?
Yeah, I'm sorry. I'm looking at it right now for you. So, okay. So I guess make sure I'm looking at what question you're asking is. You submitted the actual regulation, am I correct?
Correct.
Okay. And then just to make sure that I know. Okay. So both documents are actually from the regulation, yes? Or is the first document you were talking about from a policy?
Correct.
Okay. Well, part of it might be the fact that, I mean, if this first document was from a policy, I'm having a difficult time determining whether it's from a policy or from a regulation or whatever. It may have the content in it, and I'm not sure without reading through it. If it is a regulation, and one of the things that I have found is regulations they kind of tell you what you need to do to meet criteria for your regulation, but they don't specifically tell agencies how to go about doing that, and which is what a policy really helps bring out of a regulation. So,
and maybe that's where I'm stuck. Would you have an example of that? Because when we work with our families, we're very much regulation driven. So we use the guidance from the DCF reg manual and train our families, and that's how we do our home licensing. So maybe I'm probably just getting confused or not clear on how to drill down further of what you're needing in addition to the evidence that we submitted.
yeah, well, and I understand that, you know, the DCF has quite a few policies that you guys have to follow. Or I don't know, maybe not quite a few, but that's a relative term, but they do kind of explain this has to occur, but it doesn't necessarily say, how do you implement that? Is that, am I?
Russell? Sorry.
Yeah.
This is Denise of Cornerstones. Could we, because we're all in the kind of the same boat on that one. I'm wondering if there could be like a policy saying that we, for licensing, we follow the DCF regulations. Could we write just one policy that would cover all regulations? Would that fit your purpose then for those that would fall under what Amy's talking about? Does that make sense? Like have one policy that would apply to several issues?
You could. With that being said, I'd need, you know, the policy would need to be a little more in depth than we follow regulation and then the regulation number. So yeah, so Leslie put a good response. So the policy would need to identify how the CPA will ensure that the regulation went away on. Policy would need to identify how the CPA will ensure the FFH follows the regulations. Example, monthly home visits, talking with youth, and those issues.
And to respond to that, that was one of my two that I passed because that's how the assessment is being done. The assessment for the homes to offer the privacy by using that telephone and the internet and the other communication, we are implementing by monthly home visits and talking with you. So I think we got that side of it, and that one was marked as compliant. So what you're saying, Leslie, is just then the policy, we just need to more articulate it to specify what we're doing to support the assessment of the home.
Yeah, I think that's really what they're looking for is how are you going to ensure and support that your providers are meeting the intent of the regulation and meeting the intent of the final rule.
Okay, so that's what I think F3.1 is doing. So our assessment is where we're compliant. What we're not compliant with, and the evidence was rejected, is the policy. So the prudent parenting was submitted, but there needs to be more of a policy or procedure added.
Yes.
Outside of prudent parenting. That's where I get
don't necessarily tell you how to do whatever that regulation is wanting. It just tells you this is what needs to occur. And then the procedure, the policy says, okay, us as an agency will be following these, and you can take from the regulation because it does support how you do what the regulation's wanting. And then any of the ones that have a 0.1 on them are basically, we're looking at how do you check the family homes with that. So when you're looking at, let me see, foster homes offer privacy to persons age appropriately. How do you train them that that's what they and exactly what they need to do? Do you train them on a monthly basis? Do you do this upon admission to your program? Is that trained to offer that privacy? And then the F 3.1 would be, how do you go back and check to make sure that was done, that your training was done? So
Okay. Thank you. And again, I think the 0.1s are the two compliant areas that I think we were able to successfully meet. It's the other question. I know another agency and I were trying to work through together was H2. And I think I visited with you on the KDAD's monthly call in on Wednesdays, but I didn't know if you had any updates regarding that. And the question is, does your agency have policies or procedures that ensure all children who receive HCBS waiver services that are placed in your homes have a PCSP completed by the MCO that is supported by the medical necessity, including mental health, safety, et cetera, and reflects their rights to be equal to the rights of other children receiving non-HCBS services? I think for the challenge that we've expressed is we are not the writer for a PCSP. It touches many other hands, and we weren't able to, oftentimes we don't have the authority or the ability to have that type of policy in place. And the good news is, again, H2.1, we are doing an assessment and we plan to show and document that we are trying to ensure that this is happening. But as far as being accountable to that H2, do you have any guidance for how to submit evidence for that?
Yeah, good question. And I think probably the guidance I'll give is probably the same guidance that I gave on the stakeholder call, is that what is currently in place to allow you guys to have access is to actually, you would have to sign a release or have a release for information and request that from the MCO so that you can ensure that H2.1 occurs. The other part of that is the foster home, the individual foster homes, which probably also takes you to the 2.1 aspect. They should be involved in the person-centered service plan so that, they know what they need to do. And I know that's, again, it kind of brings it back as to how do you get that person-centered service plan?
We agree. We absolutely support that. approach, very much a team approach to all of our partners, including the MCOs and the TCMs. But I can report that just, I think in the last 2 weeks, I believe the conversation happened. I can't always track my mind. I just had an update that there was a PCSP meeting and we were not included as the child placement agency. So unfortunately, the ideal is there for us to be included, and we reach out, try to make that connection, but it does happen where some of these meetings take place outside of the inclusion of our CPA agency, which makes that criteria challenge that we're being asked to have a policy when that really is not something that's driven from us.
Right. I can see that challenge. I guess the best advice I could probably provide is that in a policy as such, you might specify it as that, in some way you would say, kind of like what you just said, that you would advocate to be part of these meetings, ensuring that you're, that as part of because the foster family should be invited to these as well.
Ideally, but that again does not always
Occur.
Yeah.
So, I'm not sure. Leslie, is that something that new DCF regulations have been working on, or?
Well, I think if we think of this very similar to the current regulation, that we expect that the foster family and the child placement agency will share information with the children's case manager as to any changes that are needed, updates, here's issues that we're having, here's things that are working really well. So that any updates to the plan can be made as necessary. So it's really, I think your policy really needs to state that you're going to maintain contact with the child placing agent or the guardian or the targeted case manager, the service providers, to collaborate and communicate regarding needed services and updates to the individual service plan. Does that meet it? When you all are talking about the F1s and the H2s or whatever, I don't know specifically what those are referring to.
Those are specific questions that.
Yeah.
I'm cheating because I'm looking at the actual document.
Yes, well, I don't know if that's what it's looking for, is how are you as the sponsoring agency for your home going to ensure that your family foster home is abiding by the individual service plan for the youth? Is that what it's asking about?
I think that's the perspective that we could meet, Leslie, if it was worded that way. But the way that it is stated is that as an HCBS provider, which CALM is one, we are then being asked as a provider to essentially have a completion of the PCSP. And that PCSP is not driven by us. It's driven by either an MCO or a targeted case manager. And those are their roles that we hope to collaborate and ideally are in the home when those things take place and we're included. But there has been situations where there is a TCM, a PCSP was happening. We were in the home, everything, seemed like it was on track. And then we never get the PCSP from a targeted case manager, or the targeted case manager didn't include in her write-up of the PCSP with the MCO our recommendations or our influence or our input. And then we have a gap in that PCSP. And according to H2, the way I'm reading it is that those who are receiving HCBS services that are placed in our homes as a CPA have a PCSP plan that supports that child. And that's where we don't have that touch point to be able to assure that in a policy. And then it also states that it reflects the child's rights to be equal to the rights of other children. You know, we can do that through some policy, but we don't have that touch point on that PCSP. We're at the mercy of MCOs and TCMs. So that's where the policy stating our homes will accommodate that is a gap.
Right. So then I mean, again, I think your focus in your policy is what are you going to do as an agency to relay that information and coordinate and collaborate with the other community service providers for that youth? Knowing full well, like there's a lot of things that are not within your control, like medical stuff is not within your control, but you have a responsibility to coordinate and collaborate to ensure to the best of your ability that those services are being provided. And you're sharing that information with those service providers that would provide that service.
And
I mean,
that's
ultimately it's up to the guardian and to sign off on the plan.
right. And the H2.1 is where we were compliant, because I think that assessment and what we are doing, we are in, we've met the mark with, and we're in compliance with that. So for whatever reason, I just am having some difficulties on constructing the policy parts. Is there any, I noticed on the site that some agencies have passed. I wondered if there was an opportunity to have any generic examples of what is acceptable as far as a policy, or maybe more training on how to create those policies, because clearly those are the 5 parts that I'm still lacking in getting that evidence in to pass.
So really what I would be looking for, like, were you talking about H2.1 is one of your questions? Like, how do you write your policy? What are you as the agency going to do to help your family request those individual service plans? So, you know, you're going to put it in writing, you're going to document in the file, you're going to do those sorts of things.
Yes, that part I've already been compliant. So I've met
Okay.
H2.1. So, and the question for that one is, do you ensure that families of all children placed in your foster homes receive a copy of the PCSP plan? And I have submitted the documentation sufficient to support that our CPA ensures that families of all children placed in our homes receive a copy of the service plan and the assessments in order to indicate that we're in compliance. So that side, like you were stating, is I get that piece. I think that submitted and I'm passing that piece. The part that the documentation that I've provided on H2 for the policy and procedures is where the evidence was rejected.
Yeah, and Leslie, to kind of help, the difference between the two is one's asking for a policy on how your agency will determine this. Any of the point ones are more along the lines of like a checklist to how do you show that you've done this? How do you show that you've went to this home and made sure that is it a checklist? Is it, so basically any of the point one questions are more along the lines of showing proof that you've done this and how you went about getting it or that you got it. So let me see if I can.
So is it H2 that you're specifically needing help with writing the policy?
H2 is one of,
Thank you, Jane, for sharing those questions.
This is Jody with Lake Mary. I just wanted to add our agency, our program actually was found 100% in compliance. And Amy, I'm happy to get with you and kind of go over the gist of some of our policies that were created to become compliant. I don't have everything in front of me, but I understand what your question is, and I think it might work easier one-on-one.
Jody, that would be amazing. I would very much appreciate that.
Okay, well, we'll set something up then together.
Thank you so much.
You're welcome.
Thank you, Jody. And I don't know, Jody, would you mind if I shared?
No, I don't. I just don't have everything in front of me. I'm fine with
Okay.
however it helps the group. It's policies that our agency created. It's actually written, the policies were written for to be consistent for our adult and children programs. So some things are in the policies that don't apply to us specifically, but they cover the entire realm of Lake Mary. So obviously everyone won't need everything that's in it.
Sure. But if you're okay with that, I can share my screen. If everybody's good with that, and if Jody's good with me sharing this policy, I can at least make it available. I think.
I mean, I'm not, I'm not a spokesperson for the agency, and if this is being recorded, and yeah, I don't know. So I said, I'm happy to meet with her. I mean, I can talk with our executive team and, clear what we need to clear, but I don't necessarily have say over all of that.
Okay. Well, with that being said, I can kind of look and answer some of the
Sure.
vague questions from it, but one of the words that I am finding very helpful for CPAs in things that they don't particularly have full control over is the word advocate. And that is something that I have seen through a lot of the policies that have been accepted, to include the one I'm looking at, is the words that, advocate for the rights of persons, advocate for the privacy, advocate for obtaining person-centered support plans, if, along those lines. So I'm finding that word goes a long way with something that you may not specifically have full control over, like the person-centered support plan.
Right. I think we did use that quite a bit, as well as making effort, just outline the efforts were being made, and then also identifying who the persons are that are responsible for those documents. So in parentheses, managed care organization for the integrated service plan, or targeted case manager for the person-centered support plan, to outline that we are not the responsible person for it, but we're making every effort to get that from them, or advocate with the foster parents to request it.
So Amy, did that help a little more?
Yes, I think I can work with that. And thank you, Jody. That does definitely help.
Sure, no problem.
All right, thank you, everybody. Appreciate hearing the collaboration that will happen in the future, and hopefully that helps. What other questions do we have that we can talk about today? And I put in the chat the link to the assessment questions, and so if anyone has a specific question they want to reference, everyone should be able to pull up that PDF online.
And I just wanted to do a kind of a check-in, because make sure, and I know some of you, yes, because I see your name quite a bit, but just to make sure in making sure that everybody here, are you the ones that are actually going into and working on this in the website? So I know I've had a few questions come up from people who are the ones actually working on the website, or going in trying to do it or trying to write the policies and doing that. And it's, they still have a few questions. So I just want to make sure that we are covering everything to help everybody get to compliance, because we think everybody is doing what they need to do. A lot of times it's just nothing's done until the paperwork's done. So.
Yeah, I see people in chat. Yep.
Yeah, thank you very much. I actually recognize most of y'all's names, so yes.
Other questions from the assessment itself, the number of questions and questions about what is meant by that, or how to provide evidence and come into compliance?
So I just want to clarify, this is Denise with Cornerstones, that we are all okay right now within our timelines, right? And that our goal, we have till March of 2023 to get fully compliant. Is that correct?
Yes, that is the federal deadline.
Okay,
So, and yes, you are on track. With that being said, we have to back up 6 months. We will still continue to work with agencies to continue to become compliant, but we'll be backing up till like October 1st is our state deadline, because that's when the federal piece of this is requiring us to start transition plans. So everything I'm seeing from you guys is not, you're well ahead of that timeline. So I'm not concerned about that.
great. Thank you. October 1st of this year or next year?
Next year, 2022.
Yeah, my goal is to not, I don't like to procrastinate, although that's just the nature of the job. But try to, definitely want to make sure we surpass your timelines.
Absolutely, and we appreciate that. So, like I say, we are trying to get through the validation and remediation reviews as quickly as possible. And if you did have a site that was, you get it through and we're there and it marked compliant, some of this is a manual process to get that taken off. So we're still working on getting all that done on our side. So, and again, we should have each one of you assigned to a provider support specialist so they can reach out and, kind of help look at what you may have, or you can discuss what you've got with them, and to help with getting this so that, you don't have to submit stuff multiple times.
All right, other questions before we end this early? Any questions about the process, about the assessment questions? Want to make sure that everyone gets their questions answered before we head out today. All right, I want to thank everyone for your time. If you think of questions later, again, you can visit the live chat or send an email, and wanted to update everyone that with the provider support specialist starting to contact providers, the live chat has reduced hours to Tuesdays and Thursdays from 9 to 5. If you visit outside of those hours, the message will still be left in the log and somebody will reach out to you through the email that you leave. But if you show up on a Monday at noon, nobody will be there like they used to be in the past. And so that message will still be logged and we'll get back to you. But Tuesdays and Thursdays are when you can talk to somebody live on the chat. And hopefully everything continues to go well and we hear from you again. And we hope everyone has a good day.
Thank you, everyone.